Good morning, everyone. It's so good to see many of you on this rainy, sort of cloudy Thursday. Um, I am Sue Stroop. I'm the Senior Career Consultant for UK Healthcare, and I am your moderator today for our Lunch and Learn workshop, which is titled The Clinical Nurse Specialist, who we are and what we do. I will introduce them a bit later. I wanted to, for those of you that are advanced practice providers in our audience today, and I know we have several, happy APP week. I've been out delivering donuts and flowers to my, the urology APPs who I adore. And I want to wish all of you a great week. And I've seen some awesome comments and things on how much that you're all appreciated. So I hope you know that. And certainly to my three speakers today, who are all fantastic advanced practice providers. So today's overview of the Lunch and Learn, we will have 30 minutes of content. All three of our speakers will be presenting, which is awesome. And then we will unmute you, or you can put at 12 noon, you can put your questions in the chat. And I will make sure that those questions get answered. And they do have a robust PowerPoint that they're going to share with you and a couple of really nice videos. Those will all be placed on the UK Healthcare Career Center website after today's presentation. And that link was in your confirmation details. All you need to do is go to the UK Healthcare and type in or search for Career Center, and you'll see 12 years of past video recordings that we've had on different career topics, which is exciting. I also just want to mention, for those of you that are exploring different graduate programs, we are having our Nursing and Health Sciences Education Fair Thursday, November 14th from 11 to 2. It will be in a new location in the KCH HA 1116, and that's that large room behind the gift shop. We have 30 or so schools that will be attending, including our tuition folks. So please plan to come to that. No registration is needed, and you can get all your tuition questions answered, as well as meeting with a ton of great graduate programs. I think we've got 7 or 8 states coming, but many of these are online. So that's a great opportunity for you to do some work-life balance and go back to school. So without further ado, let me introduce our speakers today. First, we have Dr. Paula Halcomb. Paula is a clinical nurse specialist for the Trauma Surgical Services Critical Care Units at UK Healthcare, and she's an adjunct faculty member in the UK College of Nursing. Her bio is at the very end of the PowerPoint, so that you'll be able to see Dr. Halcomb's career path. Next, we have Dr. Chris Slaughter. Chris is a clinical nurse specialist for cardiovascular services. She has many, many degrees, as our other speakers do too, and Chris's bio is also at the end of the PowerPoint. And you can see all of Chris's journey of education and certainly some of her recent involvement. And then finally, Dr. Courtney Weekly. Courtney is the clinical nurse specialist for the UK Birthing Center. I want to date myself and tell you that I've known Courtney since she was a nursing student working on her BSN. So that tells you how long I've been here. Courtney's bio, along with Chris and Paula, is at the end of the PowerPoint. So without further ado, I will kick it off to Paula. Thank you so much.
I just wanted to let you know that the speakers are going to go off of camera just while we're talking, because we're having some Zoom issues and we don't want any crashing to happen. But we'll be right back on as soon as we're done talking to answer your questions. Okay. Go ahead, Chris. I'm not seeing the slides. Hang on just a second. I apologize. Are you all seeing the slides?
No.
Okay. We go.
There we go.
So we wanted to start with just explaining a little bit about the CNS role and what a board certified CNS is. And a board certified CNS is a licensed registered nurse who has a graduate preparation in nursing as a clinical nurse specialist, so a master's or doctoral degree as a clinical nurse specialist. So they are recognized as an advanced practice nurse, just like a nurse practitioner or a CRNA or a nurse midwife. In the United States, we've got prescriptive privileges in 37 states, and we are recognized as part of the National Council of State Boards of Nursing as an advanced practice nurse. Now, some states have title protection, and what title protection means is that if you are a clinical nurse specialist or a nurse practitioner, for example, that you have to have a degree and a board certification in that particular discipline to be able to work in a role titled that. So in title protected states, to be a clinical nurse specialist, you would have to be a board certified clinical nurse specialist. But there are also states that have the clinical nurse specialist role as a job title. And in Kentucky, we are fortunate that we have the clinical nurse specialist role as a job title. So we can either be board certified or as a clinical nurse specialist in Kentucky, we can also just be an advanced degree nurse and have a master's or a doctorate in some discipline of nursing, which is wonderful for us because we have a mixed team and we work beautifully together. Here at UK, the CNS role requires a master's degree in some nursing discipline. And despite the fact that we're all not technically board certified APRNs, we all practice to the level of a CNS impacting and interfering or influencing all of the different disciplines. And we'll talk about that just a little bit further on. Next slide. This is just a picture of a portion of our CNS team, just so that you can see who we are. You can go to the next slide. So the model for the clinical nurse specialist practice that's articulated by the National Association of Clinical Nurse Specialists is based on 3 spheres of impact. And we influence or impact the patient, the nurse, or the organizational system sphere, or often all 3 at the same time. This reflects our practice, and it is consistently targeted toward achieving quality, cost-effective outcomes through patient and client care by influencing the practice of other nurses, nursing personnel, and cooperating disciplines, and influencing the healthcare organization as a whole to support nursing practice and patient care and outcomes. Originally, this was considered the spheres of influence, and recently the model has changed to the CNS spheres of impact. And within this past year, we just updated the CNS impact statement and put together a document detailing all of the ways that clinical nurse specialists impact healthcare. Next slide. I'm going to talk to you about the direct care sphere of impact. Clinical nurse specialists practice the direct sphere by having advanced knowledge and skills beyond the nursing role to assess, diagnose, and treat illness. We perform evidence-based assessment and treatment of illness, including symptoms, functional problems, and risk behaviors. We are educated and skilled in comprehensive assessment, differential diagnosis, and interventions to prevent or treat illness. We use advanced communication skills in complex situations and conversations that might be unpredictable while caring for patients throughout the health continuum. They may need us to prevent, alleviate, or minimize illness or alter risk factors, and we intervene and guide, educate, and coach the patient in modifying risk behaviors and emphasizing health-promoting lifestyles. We may coordinate the direct care of an individual or a specialty population if we're board certified, but in our hospital setting, we also impact the direct care of our individual patients or specialty populations by working with our multidisciplinary teams, including our providers, essential partners, and our staff nurses in impacting the patient's care. We do a lot of support for newly diagnosed conditions, and we work with our nursing staff and our providers to support these. Board certified CNSs, if you are credentialed at the facility that you are working at, may prescribe medications just like any other APP. You can order, perform, and interpret diagnostic exams, provide health promotion and health teaching, and pharmacologic and non-pharmacologic interventions. Next slide. This is just a slide talking about the complex interventions that clinical nurse specialists can do. And you can see this slide here, but I'd like to tell you just a little bit about what we actually do in our role at UK and give you some examples of some of the things that we do in our day-to-day practice. We lead a lot of teams dealing with different patient situations and patient populations. For example, recently, and I'll just give you an example on my service line, I led a patient care conference regarding mobility issues in a patient, working with physical therapy and providers and staff nurses and management to determine the best plan for a particular patient to prevent them from ending up stuck in the hospital, not being able to go home and having to wait for a skilled rehab facility. So we do a lot of consultation in that manner. We do specialty consultation for things, for example, helping nursing staff and providers begin therapies, for example, aquapheresis on the cardiovascular service line. On the trauma service line, we do a lot of consultation with cervical collars and nerve blocks for rib fractures, which is an ambit device. So my partner and I do a lot of work in that area. We do consultation with the primary clinics. Lisa and I, my partner on the service line, have done education for C-collars in the clinic setting. We see patients that have issues with wounds, trying to get equipment and supplies, sometimes in the clinic to help out in the clinic setting. Next slide.
I'm going to talk a little bit about the CNS sphere of influence and impact on nursing practice. And the CNS advances nursing practice and improves patient outcomes by ensuring that nurses and nursing personnel utilize evidence-based practice to support families and patients across the care continuum. The CNS conducts clinical inquiries and determines the need for changes in practice. The CNS exerts influence through role modeling, consultation, and education with other nurses and healthcare providers to improve nursing practice and our patients' outcomes. The CNS is a skilled communicator and educator. The CNS listens, validates, reflects, and provides constructive feedback and supports the nurse and nursing care team. One example of this is through our wildcards. The CNS creates and develops evidence-based policies, procedures, and protocols. I think a lot of our staff see us in this role in their support. And we model best practices and using evidence-based guidelines to advance clinical and specialty knowledge. The CNS assists the nurses and the interprofessional team to evaluate and change practice standards and ensure that nursing practice is evidence-based. There's a lot of collaboration with each of our disciplines, and we spend a lot of time in rounds and monitoring the care that's provided, consultation with complex cases, especially if it's a particular device or a skill set that the nursing staff are new to. We tend to lend a hand and mentor and role model for the staff. Next slide. And the third sphere of CNS impact is the organization and system. And it is critically important for the CNS to be involved in this sphere of impact because of the evolving complexity of healthcare. The CNS is really positioned to articulate the value of the nurse's contribution to the healthcare outcomes at the organizational and decision-making level and advocating for professional nursing. The CNS's advanced assessment, diagnostic, and collaborative skills, coupled with advanced knowledge of systems, patient safety, research, and quality, allow the CNS to facilitate projects and policy changes which enhance patient outcomes as they transition across care settings. To enhance the abilities of patients and their families to manage care at home, The CNS can lead nursing and interprofessional teams to implement innovative patient-centered care programs that address patient needs across the care continuum. The CNS also leads systematic quality improvement projects and safety initiatives based on gap assessments and data analysis to improve our nursing practice, to provide safe, high quality, and cost-effective care. Our CNS team collects and analyzes patient data to document the impact of nursing practice on outcomes, efficiencies, and cost effectiveness. The CNS interacts with government and regulatory agencies, our insurance providers, community leaders, and consumers to assure access to healthcare services and safe, competent nursing care. This slide kind of demonstrates our CNS specialties. It could be through a population like pediatrics. I mean, our good friend Jessica Lawrence is our pediatric clinical nurse specialist. We actually have women's health, which will be Courtney. She'll talk a little bit about that. It may be our settings, and we may be setting driven, whether it's interventional services or our ambulatory partners. We have 2 ambulatory CNSs currently. We have an emergency department CNS. We also have our disease and medical subspecialty groups, which are oncology and diabetes. Whether or not it's the type of care that we're providing, whether it's psychiatric or rehabilitation medicine, and then the type of problem that we may have, we actually have a wound care CNS that leads our wound care program. These are the CNS competencies that are outlined in the state boards of nursing. As healthcare providers, we provide direct care to individuals, to populations as an independent practitioner, leaders of teams in the organizations to improve our quality and safety of care. We develop programs to prevent avoidable complications and harm to our patients. We provide coaching to those patients and families that are dealing with chronic diseases to help prevent hospital readmissions. We also are part of a group that works with our consumers so that we make sure that evidence-based practice and best care and services are provided to our patients and their families. And we have a PhD in our team. That's Dr. Linda Clements. She is our researcher. We have a lot of work that she has done in the heart failure space, but generating new knowledge and improving outcomes of patients. And we all tend to participate in some form or fashion in research here at UK Healthcare.
So this slide is just showing some of the certifying organizations and the Board of Nursing, which are all involved in APRN licensure and regulation. So it's a joint effort among various organizations. Prior to about 2008, which is when the APRN consensus model was endorsed, there was an increasing appreciation of the value that APRNs were bringing to care, along with their ability to increase access to care. But there weren't really common definitions or clear delineations about APRN roles, the appropriate credentials, their scope of practice, and the educational preparation wasn't standardized amongst programs. Because of these issues and the confusion that it caused, APRNs weren't able to practice across state lines using the same license. The consensus model for APRN regulation, which includes licensure, accreditation, certification, and education, identified the 4 APRN roles that are recognized today, which is the CRNA, the CNM, the nurse practitioner, and the CNS. The consensus model requires APRN programs to be pre-approved by nursing accrediting bodies so that when nurses graduate from these programs, there's no question that they have the correct educational preparation, so that they're able to take the relevant certification exam that they need and obtain their APRN license from their Board of Nursing. And this diagram illustrates the progression from the graduate program there at the bottom moving up through where you obtain a specialty certification. You'll notice on that second level that all APRNs receive the same core content in the graduate program, the 3 Ps. So when I took my courses, I was in the same class as all of the NP students. So we all take that same base content. And then the courses progress onto the role specific or population specific competencies.
Like Courtney said, we do actually have 4 APRN roles that are recognized by the state of Kentucky: the certified registered nurse anesthetist, the certified nurse midwife, the clinical nurse specialist, and the clinical certified nurse practitioner. The 6 population foci, typically in your educational preparation, you're going to pick a population that you want to focus on. For myself, I did adult gerontology. I know that you can do adult gerontology and then kind of bridge the gap if you want to do psych and mental health. So there are actually educational programs depending on your APRN role that you're educating towards, but then also based on your experience and your education, that will be important when you go to take an educational certificate or a national certification for your APRN role. I wanted to share a few APRN stats for the state of Kentucky. I thought it was really interesting, but this actually breaks down the most prevalent types of APRNs in Kentucky. 85.7% of our APRNs are nurse practitioners. 12.1% are nurse anesthetists. 1.2% are clinical nurse specialists, and 1.0% are nurse midwives. And almost 2/3 of the APRNs work in urban settings. So that's not uncommon. The next slide shows where the APRNs are actually self-reporting that they work. And obviously this map reflects that the greatest concentration of APRNs are in Jefferson County or Louisville, and then Fayette County. But the majority, if you look over towards the Cincinnati area, the Northern Kentucky Cincinnati corridor, there's a pretty high concentration there. And then it's kind of a mixed bag, but down in the Western Kentucky Delta region, it is much smaller numbers of APRNs that report working in one of those counties.
Just want to talk a little bit about the educational options. So there are CNS programs that are master's degree or postmaster's certificates, or you can do it as a DNP or in a PhD program. And we talked a little bit about it before. You know, in order to be nationally certified as a CNS, your education and clinical hours have to be from a CNS program. But institutions like UK use the CNS title with just master's or doctorally prepared nurses. Down here is a link to universities with a CNS program. UK no longer has a clinical nurse specialist program where Chris, Courtney, and I all attended. But if you click that link, and we can make this link available to you, it will show you all of the CNS programs in the country. Some of those are online as well, exclusively online programs. Next. There are a couple of different tuition options. If you want to do just a master's or a doctorate in nursing, then you can use the EEP program, which is at UK. But there's also the UK Healthcare Nursing Tuition Contract, and it's a work-back program that provides tuition payments for current licensed nursing staff pursuing a degree not offered by the UK College of Nursing. And there's a link to the policy. Andrea Wright is the one that knows all of the answers about questions and about how to go about applying this program. I know you have to be a current licensed nurse working an FTE of 0.5 or higher. You have to have completed your 90-day orientation period and have at least 6 months of service at UK. No written corrective action within the last 12 months. You need to be already accepted into a regionally accredited nursing program. You must be a direct care provider at least 50% of the time or in a leadership position here at UK. They'll fund up to 18 credit hours a year. Work back is 1 month per credit hour funded and starts the date the degree is awarded. So work back is capped at 24 months. Payments are paid directly to your school and they are not taxable. The tuition contract covers tuition only, so you will still have to cover online fees, books, etc. They will pay up to the UK rate for the same degree level, MSN or DNP. And if you leave UK healthcare or drop to a PRN on-call status before completing your work-back obligations, you will have to pay back the unfulfilled part of your work-back contract. I know that they make these decisions based on looking at applications on a committee basis, and Sue is on that committee and she can answer questions for you. And also Courtney actually utilized this program when she was working on her degree, so she can also answer questions. Next slide. I did want to talk about the actual clinical nurse specialist certifications that are available currently. There is the adult gerontology clinical nurse specialist certification. There's a pediatric and a neonatal clinical nurse specialist certification. And then there are some programs or some certifications, I apologize, that are available now only on a renewal basis because they have actually, those exams have been retired. So the CCNS adult, peds, and neonatal, which is the critical care clinical nurse specialist, those are critical care nurse specialists. Those are retired. And then those all come out of the American Association of Critical Care Nurses. Then the American Nurses Credentialing Center, which is a primary care certification, is the adult gerontology CNS or the acute care CNS board certified, which is retired as well. And I'm old enough that I am an ACNSBC. So it's an older program. Okay, next. These are just some of the variety of work settings that are available to you as an advanced practice nurse that's board certified. You can basically practice anywhere any other advanced practice nurse can participate in practice as long as you are credentialed that way at that facility. For example, at UK, although there are board certified CNSs, we aren't credentialed to work as in a direct patient care writing orders role at UK. Next slide. The job market, there is a high demand from organizations to improve quality outcomes and save money. And CNS is one of the differences between us and some of the other disciplines of advanced practice nurses that we are very skilled in dealing with organizational issues. So we are able to look overall at outcomes and quality metrics and things like that. Clinical nurse specialists or other APRNs can provide specialized care at a lower cost than physicians. Here at UK, we have 21 CNS positions currently, I believe, so at least one for most service lines, and then, as Chris said, some population-based CNSs. If you look at the healthcare profession and salary database, the average salary ranges 80 to 120,000. I will say that I've been a nurse for almost 40 years, 39 years this year, and this is probably my favorite job that I've ever had. I loved patient care, but I love this role, and we have an amazing team that works flawlessly together. We all help across service lines and are available to help each other with anything, and it makes it a wonderful work environment. Next.
Okay, we're going to share a short video that kind of brings together everything we've discussed, and we think it depicts the CNS role very well. If you all can't see this or hear it when I share, let us know really quickly and we can try to reshare.
You're asking yourself, what does a clinical nurse specialist do? Well, let's walk through a day in the life of a CNS. The CNS is an advanced practice registered nurse prepared at the graduate level as a clinical expert in diagnosis and treatment of illness and in delivery of evidence-based nursing interventions. As one of 4 types of advanced practice nurses, CNSs integrate their advanced competencies across 3 spheres of impact: nurses and nursing practice, systems and organizations, and direct patient care. The CNS role ranges from wellness to illness and from acute care to chronic care. CNSs provide expert care for patients across the lifespan. Depending on where they practice, a CNS may start their day at a hospital, an ambulatory clinic, home care, or a health system. They make rounds, perform assessments, and consult with nurses on complex patient care needs. They conduct clinical consultation, including coaching with bedside nurses regarding performance of complex patient care interventions. CNSs use system-level knowledge to lead improvements in patient care and outcomes, including preventing hospital-acquired infections, reducing lengths of stay, and preventing hospital readmissions. CNSs can provide well-child assessments, school physicals, and interventions in the ambulatory clinics. They may also lead conversations with patients and families regarding disease education and goals of care. CNSs teach parents how to care for their child's complex medication regimens and perform visits to assess the effectiveness of patients' home care plans. Although their direct care role may vary, the CNS scope of practice includes being able to prescribe medications, medical supplies, and durable medical equipment. In many states, CNSs are licensed independent practitioners and practice under standards established by licensing and national certification bodies. They assist nurses and the interprofessional team to evaluate and change practice standards, ensuring nursing practice is evidence-based. CNSs lead cost-benefit analyses of newly available patient care technology, considering the clinical benefit of the decision. They can lead a healthcare facility team in pursuing their magnet journey. Based on current benchmarks and best evidence, CNSs assess, plan, and implement team-based strategies to improve patient safety and quality. The CNS advocates for professional nursing, sharing the value of nurses' contributions to healthcare outcomes with organizational leaders. Advanced clinicians, research quality improvement and evidence-based practice experts, educators and mentors, leaders and innovators, and collaborators, all toward improving care outcomes for our patients, families, and communities. It's all in a day's work for a CNS.
Okay, so here are some just general references of some of the places that can offer a lot of information about APRN, the APRN role and clinical nurse specialists specifically. And we will make sure that you have this link to the programs. We can put that in the chat in a second. I'm going to leave these up briefly. I believe everyone will get the slides so that you all can read these after the fact. These are just our bios. Same thing with our contact information. It's here. We're all in the UK email system as well, but this will be on the slides. So we will switch over to Q&A.
Thank you all so much. Excellent presentation. As I mentioned earlier, we haven't had the clinical nurse specialist career lunch and learn, oh my gosh, in several years. So this was great updated information, great career, and certainly educational options for them. what questions do you all have in the audience for our speakers? You can, we can unmute you, or you can please put your questions in the chat.
I see one question. Do we currently have any nurse practitioners in the CNS role at UK? Yes, we actually do. It just so happens that our boss is a nurse practitioner. And also one of our ambulatory CNSs is a nurse practitioner, Sarah Wellman. And I don't know if anybody else is or not. Sarah Lester is actually on here, and we can ask her, does she know? Do we have any more besides you and Sarah Wellman?
Yes, Sarah Darmachi.
Sarah, yes, Sarah Darmachi, yes. So we do, we have at least 3 now, so.
Excellent. How about I ask a question? Because as the career consultant, everyone always asks me this. Do you think it's valuable that a nurse interested in a CNS graduate program or nurse practitioner graduate program possibly shadow one of you?
Absolutely.
Absolutely. We actually, my partner on my service line actually has somebody that is going to come and shadow with her because they're curious about our role. So I think it would be very beneficial.
Great.
And I would even add potentially more than one person, even if that's a different service line than you're hoping to practice in, because every day is different for us in some way, and we all function a little bit differently in different ways. So I think maybe even multiple people.
Also, I just want to add, thank you, Courtney and Paula, for adding that. I just want to add, there's a lot of paperwork involved in shadowing and observing if you are not a UK healthcare nurse. You might see those people on your units that have those big observer badges, and there's about 16 pages of work that they have to fill out. But I have gotten all of you exempt from that, because you are doing this shadowing for career exploration purposes. You're already a UK healthcare nurse, vetted through the system. So that's a good hurdle that I've gotten you exempt from.
I was just gonna say, Paula, I'm the one that messaged Lisa yesterday. Hi, I'm Hannah. No, I've spoken to Joe, Laura, Anna Ellis, and Kristen Scalf, or Stacy, pretty often about like the CNS role and what they really do. That's why I reached out to Lisa to see kind of like what the difference between service lines are. What do you guys feel like you take away most from other service line people, I guess?
You know, every one of us, there's overarching themes to me where we do things the same. There are certain things that we all do the same, but every one of us does something a little different. And the beauty of this role is that, 2 people even that are on the same service line even have little areas of expertise of things that they are involved in that they do for people that's different than their partner may or may not do. But I learned something from every service line. And for example, we call peds and ask questions about things. Jessica Lawrence has an amazing attention to detail and looking at things and being able to pick out a critical issue. For example, she recently discovered a really dangerous issue with an order that had gotten left over from when we switched to Epic from SCM. So I think we all learned something different from each of our peers. What about you guys, Chris and Courtney?
I would say that it also, whatever your passion is, this role allows you to kind of explore those passions. I'm a big supporter of certification, and I sit on the ANCC cardiac vascular exam group where we're working on the
We lost you, Chris.
I think we need to probably maybe take us off of camera again because of our Zoom glitches. everybody, if you take
Technical
yourself off a
I'm
camera.
sorry, we had technical difficulties. I do want to go back to Hannah's question. Oh, unmute. We're muted.
No, you're good.
Oh, okay. It just popped up that we were muted. I'm sorry. I want to go back to Hannah's question in the chat. What was that question?
Now we won't see it.
Oh, we won't see it, but can you see the question that Hannah Jones put in the
Oh, Kendall Jones,
Kendall, I'm sorry.
the recommended average amount of years and experience before pursuing the CNS role.
I think that varies. I know that the graduate programs have their own criteria. So once you feel like this may be a role that you want to participate in or go back and get your advanced degree, I don't think there's any time frame that we recommend. I think you want to feel confident in your knowledge about the area that you're going to be practicing in. So, I mean, I definitely, after 33 years of adult, would definitely not go to NICU. That would not probably be a practice area that I would, go and practice in. But you get a pretty good balance of preparation in your educational program. And it takes time to get through these programs. So you're going to have a couple of years of education preparation while you're still working. So I think that's a great question. I think that it varies by the individual.
And
I
just to
do
add
think-
on to that, our clinical nurse specialist application process recommends at least 5 years of experience in that area of expertise. That's not like a mandatory, but that's kind of the general guideline that we ask for.
Thanks, Sarah.
I do think it's important that you have enough experience and have worked enough in your area of specialty that you feel comfortable mentoring other people, because we're here to be a support, not only for the patients, but really a support for the staff and the organization. So you do need to be really comfortable in your knowledge.
Thank you all for answering that. Those are great questions. Any other questions, as we have about 2 to 3 minutes before we say goodbye? Any other questions for Dr. Slaughter or Dr. Halcomb or Dr. Weekly today? Guys have been so thorough. You're excellent teachers and mentors and preceptors, aren't you? All righty. Well, again, I'm Sue Stroop. I want to thank all of you for participating today. This is being video recorded, and our video recording link will be up on the Career Center webpage. That is UK Healthcare Career Center, along with all of our past 15 years of career videos from our Lunch and Learn workshops. I definitely want to thank Dr. Slaughter, Dr. Weekly, and Dr. Halcomb. They've done an outstanding job. Yay, kudos to all of you. I told them in my email yesterday, I was originally a clinical nurse specialist back in the 80s, but never practiced. So I applaud their careers and their expertise. It certainly is something that's very close to my heart. Next month, we will have another Lunch and Learn workshop for all of you, and it will be our graduate programs from the University of Kentucky College of Nursing speaking, and they will be Thursday, October 24th. Again, 11:30 a.m. on Zoom. So all of you that joined us today will be invited to that. If you're interested, UK has 7 DNP tracks and an MSN in Nursing Executive Leadership, as well as many postmaster certificates. So definitely want to please join us for that exciting Lunch and Learn. And all you need to do is email me and let me know that you want to attend, and we'll get you that Zoom link. And again, for those of you that joined us late, do also want to give a shout out to our annual Nursing Health Sciences Education Fair, which will be November 14th. We'll have about 30 graduate programs here, and it'll be in a new location this year, KCH, HA 1116. No registration is needed, 11 to 2. We've got, again, 30 graduate programs, also some ADN programs coming, and our tuition folks to answer any questions about how to get tuition reimbursement for those programs that UK does not offer or UK does offer. So again, some exciting career opportunities and professional development for all of you. So if my speakers will stay on with me, we will have everybody get back to their day. And again, thank you all for attending today's Lunch and Learn workshop, and hope you guys have a great rest of your advanced practice week for those of you that are advanced practice professionals. Thanks again.